Hey guys, ever wonder what a headache or a migraine is? So these two things are entirely separate and they don't have anything to do with the level or severity of pain moving you into a different category. They are two totally different pathophysiologies, and how we go about treating each one of them is also very different. Making sure that we don't just call any headache that feels really bad a migraine, or any migraine that doesn't feel that bad a headache. So a headache is largely dural tension, and you're going to feel this globally throughout the entire head on both sides. A lot of people explain a headband feel. A lot of people have both frontal lobes, kind of this forehead pain tension. Some people feel in the back of the head on both sides, but that tension is quite literally endural tension. And oftentimes it does come from the back of the neck and these, what we would call a cervicogenic headache. These are things that respond really well to neck massages, any kind of like chiropractic care or lick dry needles or lasers to the back of the neck, because we're changing what these little muscles do and how they connect directly to that dura mater, or what you could think of as like a cellophane wrap around the brain. So when those muscles are tight or dysfunctional, they put added tension to that cellophane wrap, or what's called the dura mater, which then increases that tension within the brain, and that's where you feel this headache. We can also get that from dehydration. We can get that from overworking. We can get that from a whole lot of things. But it's important to note that no matter how bad the head hurts, if it's global, if it's on both sides, that is likely a headache, no matter how painful it is. Also, whoever is your provider that you're seeing to treat your headaches or your migraines should be delineating or distinguishing between the two and which one you specifically have, because treatment's going to vary from headaches to migraines. Migraines are a largely neurovascular issue, so it's nothing to do with the dura tension. It has everything to do with vasoconstriction and vasodilation. So when you feel that pounding headache or that pounding migraine, see, even I do it, that pounding migraine, that's blood flow, that's a migraine. So oftentimes the migraines are one-sided. You'll feel an ice pick through the eye, you'll feel some pain right through the temple, or you feel that pound on one side where if you press here, it's like, oh, that fully relieves everything. Those migraines, that neurovascular component needs to be addressed through a multitude of things. Not just neck care, not just musculoskeletal work, not just pharma or over-the-counter drugs that are going to help with this, but a system that helps improve metabolics, that helps improve mitochondrial health, that helps improve autonomic nervous system health, because how your nervous system controls vasodilation or vasoconstriction has a lot to do with the migraines. Those could be triggered by histamines, hormones, inflammatory things in your environment. Could also be triggered by stress or a whole host of other things. So distinguishing between headache and migraine is extremely important, and it has nothing to do with severity. Knowing which ones we have helps us find pathways of healing and feeling better. So you're not going to treat a headache the way you would treat a migraine, and vice versa. You're not going to treat a migraine the way with headaches, right? So headaches, neck massage, things that are going to maybe trigger points around the head that are going to help with that, breath work. If you're dealing with a migraine, lots of water, some caffeine, some things that are maybe vagus nerve stimulation if you have access to that, hot towels on the neck and very cold water in the feet, vice versa. That temperature flux can throw hemodynamics for a spin and really help get you back into proper flow, if you will. It's important, like I said, to distinguish. So if you haven't already, find a provider that's going to help you distinguish if you're dealing with a headache and why, or if a migraine and why, because that's going to determine your treatment. Again, if you've been trying to treat a migraine with a headache, you're going to be on this road for a long time. If you're trying to treat either one of them and you're still unsure and you haven't seen the results, give us a call. We'll help you delineate. We'll help you get on a treatment plan that's right for you, not just the category of what you're dealing with. So if you found this helpful, like the video, leave a comment. If you have your own practices that work really well for either your headaches or your migraines, leave them below. Other users are going to find that extremely beneficial. And if you haven't found somebody who's treating you for your headaches or migraines, or have been seeing the same person with very little results, reach out to us. We can get you started on the plan that's right for you.